Did you guys know that the pandemic is over? 3 years after it started, according to the WHO, it has been downgraded. The Rona outbreak has been downgraded from the highest level emergency. It is no longer considered a global emergency. Now, this is a little misleading because I'm seeing out there, the reaction to this out on the inner tubes, of course, is conservatives and stuff losing their minds over it and celebrating all this other crap, blah, 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 right? And I just want to kind of emphasize to you guys out there that no, the pandemic is not over. It's not over. It's still very much happening. It's still very much a giant problem. I think people shouldn't overreact when they hear this news, right? But what it does mean is that the numbers of infections and deaths and dying is way lower and is actually starting to has started to hit manageable levels. So I want to kind of show you guys some things here, right? We have this is the WHO coronavirus tracker. Let me go ahead and open up my laptop here so you can see it. Just kind of want to show you guys what exactly is going on, right? So it's actually really cool here. They have this sort of map that you can go in and you can check and see, like, how many countries have had this many deaths or this many casualties, whatever, right? But I want to kind of show you here. Here's the graph of confirmed cases since the beginning in April of 2020 when the shit hit the fan with the Rona. And this is the number of deaths. Now, if you take a look here, right, all throughout 2020, number of confirmed cases were rather low. See how low these cases are? 80,000, blah, 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 blah. And then you got these two huge spikes in beginning of the year, January 2022, and then a massive spike in December, right? But if you look at the number of deaths, these are confirmed deaths, right? So first off, there's almost 7 million, which is mind-boggling. Mind-boggling that almost 7 million people have died of this in the last 3 years. But if you look, the number of deaths were massive all throughout 2020, all throughout 2021. Just massive, massive, and this is worldwide. This is not just the United States. This is worldwide. That's why it's so high. If this was the United States, this graph would be a lot lower. But still, this is huge, huge, huge. I mean, I don't think people understand exactly the breadth and scope of this pandemic on a worldwide case like that. 7 million deaths is not something to sneeze at. It's not a small, mild case of the flu. No, this is a life-changing stuff here, right? That should change society as we know it, of course. And any other, it won't do it now for us because we live in the worst timeline. But any other civilization out there would have learned their lesson from this and actually would do something to provide people with health care, but not our civilization. But if you look here, what happened right around this time, right around January of 2022, right? You get a huge spike in cases and a huge spike in deaths, and then the deaths taper down. And they kind of go up a little bit and then they go down, right? What happened here? This is when, right around at this point, right around January to April 2022, is when the first wave of vaccines became available to the general public. So if you look here, right around the beginning of 2022 is when they started being right around the end of 2021 is when they started being given to old people, and then it becomes available to the general public, right? So right around here, January, you get a huge spike. This spike here is from Christmas, right? So a few weeks, it takes about 2 weeks for it to sort of germinate in your body once well, maybe 2 weeks. Sometime, I mean, when I caught it, it only took about 4 days for it to show up in my system. But the first strain can take apparently up to 10 days. So that's why they had this huge spike in January. But then people started getting vaccinated, and then it started going down. Number of cases went down, number of deaths went way down. And then there was a little mild bump here, right? This little mild bump was another strain. I forget the name of it, but the whatever strain that came out right around that time in the summer of 2022. And then it went way down. And then here we had a massive spike. What's this massive spike? This is Christmas of 2022, right? This giant spike here went way up. But if you look at the number of deaths, didn't. There was a spike in deaths in Christmas, right? But they're not. It's not anywhere close to the rest of the pandemic. This is the effectiveness of the vaccines, right? So it's if any if any of you have friends or family out there who are vaccine deniers, who think that the vaccine doesn't actually do anything, or think that it's like the spawn of Satan, that it was put together by Bill Gates in order to inject microchips into your body in order to track you, or something ridiculous like that. Here you go. Here's some more evidence. You can, I doubt it'll change anybody's mind, but another tool that you can use to try to convince people that no, vaccines work. And now, if you look, this right around this time as well is when they started to just sort of report it on a weekly basis. So that's why you see these little tiny spikes here. It's because now they don't report it daily. So you just get this information just gets updated per week. So at the beginning of every week, there's a spike. There's a spike of deaths, right? And then it kind of goes down like that. So what does this actually mean, right? This means that the number of deaths is still actually very high, right? There's no way for me to zoom into this, unfortunately. But if you look right here, it'll say 267, and then I go one day, and now it's 2,549. And then I go another day over, and then it's down to 329. See how that's working, right? It's because we're getting all of this information on a weekly basis here. It's updating. So it's updating one day a week. So one day a week, there's this huge giant spike in deaths. Well, what it is, that's for the entire week, right? So what that really means is that the number of deaths is closer to what you should be seeing over here, right? So we're kind of at this level right here. That's roughly where it's at. Like if you look at the little spikes here, you can kind of see it. You can kind of see that's where the real level is, right? So really the pandemic is not over at all. It's not over at all. There's still literally hundreds of people dying every single day on a worldwide basis, right? It's actually still pretty goddamn high if you look at this, right? Look at that, April 9th, 2,500 people, right? The latest that they have, it has been trending downward though. So this is the latest one from that they have here, April 30th, 1,700. You can kind of see it. I mean, it may not be a global emergency anymore, but that doesn't mean that it's over with. It is pretty far from being over. Now, this is the worldwide cases, which is it's amazing how many. I mean, look how many confirmed cases. What, 765 million. It's like, Jesus Christ, that's ridiculous, right? But keep in mind, folks, that these are the conservative estimates. These are just estimates. Okay. These are confirmed cases where people went and got tested and that test got counted. So it's not counting all of the people out there who got tested and never reported it, or the people who caught it and never reported anything, right? Or the people who died from it and never went to a hospital and never got or who died from it but their cause of death was counted as something else and not COVID. Because that happens a lot too, right? Someone who will have, like, say, cancer or something, or emphysema or whatever, will catch COVID and then die, and but the cause of death won't be from complications of COVID-19. It'll be from lung failure or something like that, right? So, and then there's other countries that don't have the medical infrastructure in order to report the sufficient stats, right? Places in Africa, South America, North Korea. There's no information from North Korea. We don't know what's going on there. Some of these countries are vastly underreporting their numbers, right? If you look up here, look at China, right? It says confirmed deaths 120,961. That's ridiculous. It's probably 5 times that, maybe even 10 times that, right? You got to remember China has a billion people and they're taking extreme draconian measures. China will do stuff like one person in a department store will test positive and then they'll shut down the entire department store and they'll lock everybody in the department store in these, just imagine that, like, imagine you go to like the mall and you go to Macy's or something and then suddenly the doors close and you're stuck inside that Macy's for 2 weeks. Right, that is what's happening in China. Those are the measures. Well, you don't take measures like that unless literally thousands and thousands and thousands of people are dying, right? You don't do that. If for 120,000 over 3 years, you don't take measures like that. No, that's ridiculous. There's way more in China. This is just what has been publicly available, right? Same thing in Russia here. Like, you can't really. Can I zoom out? Okay, there we go. Russia here says they only have roughly 400,000 deaths. No, it's probably closer to 1 million in both of those places. So keep that in mind. Is that we have the highest in the United States, 1,124,000 deaths from this reported. That's because we're doing a better job actually reporting the cases, reporting the deaths than other countries out there. That other countries with similar sized populations, right? You look at Brazil, same kind of thing. They have a better medical infrastructure, right? They're reporting it more. So it's like, I mean, where do you think more people have died from it? Brazil or China? Right. Brazil has what, 400 million people. China has like a billion. I mean, obviously it's no, no, no. These numbers are just estimates. There's probably closer, like I mean, I don't want to guess, but there's way more than, I mean, this is what, 7 million people now. Way more than 7 million people have died of this, right? If you get to the United States, here's the COVID data tracker from the CDC, right? Kind of shows you your new cases and deaths on a weekly basis now. They don't do it. They used to do it on a daily basis. Now it's a weekly trend, right? And you can see it's been trending down for the last month. The same thing that we saw in that other graph, right? But still, this is the total, weekly total, right? Actually, I shouldn't have clicked on that. Let's go back to this. Weekly total, right? 1,109 per week in the United States, which that's not over. That I don't understand by any. I mean, imagine if 1,109 people died of the Ebola virus in the United States. Imagine that happened, right? People would be shitting their pants right now. There would be lockdowns right now. There would be actual measures being undertaken, right? Imagine that happened. Imagine those 1,000 people died of smallpox last week, right? We would not be having, no, we wouldn't be having these conversations about, oh, COVID is over with and all this other crap and, cutting funding and all that to the COVID response and they've been subsidizing the vaccines and stuff. They're gonna stop doing that pretty soon. So when you go get a vaccine, it's gonna cost you like $200. That's coming, right? This is it's a joke. The response to this pandemic is an absolute joke, and it really shows that even when that our society is broken in a way that I think is it's beyond repair at this point. If we can't, if we don't give a shit enough about people to help them when they're dropping dead of an easily prevented disease like this, then forget it. There's no hope for mankind. Really, I really think that, I give us 300 years max before mankind is extinct at this point. Because when something comes along that's going to kill us all, we don't do anything about it, right? Not only do we not do anything to help other people, right? Some people use it as an opportunity to make a shitload of money. Other people will do the exact opposite of what's needed on purpose just to piss other people off. That's what we saw. That's what we saw with this pandemic, right? You know, like, I mean, let's go ahead and turn this off for now. We don't need these now, but I think I've made my point here that it's not over with. But think about what happened with the pandemic. Think about our response to it, right? Did we do the logical thing? Did we shelter and get people health care and get people the medicine they needed and all that? And then when the vaccine came out, did we all take it and all that? No, we didn't as a society. I'm just talking about the United States now, right? Just talking about the United States. I can't speak for other countries because it seems other countries on Earth have handled it a lot better than we did here. But in the United States, no, we didn't do that at all, right? We botched the rollout of PPE. If you remember, the Trump people, Jared Kushner in particular, was selling it to his buddies. The government was confiscating things like masks and hand sanitizer and stuff like that, and gloves and N95 masks, things like that. The government was confiscating that stuff and then selling it to the highest bidder. And then governors of various states had to like smuggle it in order to get it past the fucking Secret Service and stuff like that, in order to so that they can get it to their people. And then an entire segment of our population wouldn't take basic fucking precautions in order to stop the spread of the disease, right? Because what's the one thing you can do when you don't have a vaccine in order to stop the spread of disease? What's the one thing you can do, right? Not get into close physical contact with other people. And if you have to, wear facial protection, wear a mask, right? Because that has been established science that we've known has worked for literally 100 years, right? A physical barrier in order to stop water droplets, like aerosolized water droplets when you sneeze or when you cough. That's how the shit spreads, right? It's not like it's a virus. The virus doesn't just fly through the air for no reason. It's inside of mucus droplets when you sneeze. It's just like a flu, just like a cold, right? What happens when you sneeze in somebody's face when you have a cold? They catch the cold because that's how the shit spreads. Well, how do you stop it from spreading? Well, if you have a barrier in front of your face, then you don't, that's the first layer of protection. It's not 100% effective all the time in every case, but it's the first layer of protection in order to stop you from inhaling those water droplets, right? And we know this shit works because when people wear masks, they're less likely to catch the goddamn disease, right? So we have an entire segment of the population who just refuse to play ball, refuse to do that, refuse to, for one reason or another, whether they think it doesn't work. I've heard every goddamn excuse in the world, masking doesn't work, it's my freedom, I don't have to do it, the government can't tell me what to do, blah, 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 blah. It doesn't fucking matter. Whatever dumb shit, stupid ass excuse people came up with, right? The end result is that people were doing the exact opposite of what needed to be done in order to stop the spread of a disease, an easily preventable disease. People were doing the exact goddamn opposite because they're fucking morons. We're morons. We live in a country full of morons, right? Left wing, right wing, all of them. Complete fucking morons. And I don't want to say it was overwhelmingly people from the right wing. It was overwhelmingly the red hat wearing Trump supporting douchebag morons who were catching and spreading COVID in order to pwn the libs. But there are other people too who are just plain too fucking stupid to pay attention, right? There's people on the left who are into alternative medicine and stuff who refuse to take basic fucking precautions to stop a pandemic too because they're fucking idiots, and they thought it was like big pharma trying to stop, control everybody, right? There's other people who are conspiracy theory morons who think it's Bill Gates trying to infect you with a microchip or something, some stupid shit like that, so that 5G cell towers can activate the virus in your body. Like this is all like I wish I was making this shit up, but I'm not. This is all stupid conspiracy theories that I heard, and it spread around like crazy. And then it wasn't. It literally was weeks before the whole response to the coronavirus became politicized, and then it became a thing where conservatives in general would not believe that corona was real. They wouldn't believe the pandemic was real, and they thought it was all. As soon as Biden became president, suddenly the response to the pandemic became a political thing, and these goddamn morons got 1 million people in this country killed. It's almost at 2 million. You saw it. It was, the number of just in the United States. We're almost at 2 million people just in the United States dead from this 2 million people who were alive 3 years ago. There are people in New York, for example. It's something like the average is. I just saw an article on this. Have lost 3 people to the virus. That's the average. Like the average person has lost 3 people to this virus. It's ridiculous. It's absolutely ridiculous. But what are we doing? Like, and it's not over. The shit's still happening. What are we doing? Nobody wears masks anymore. That's over with. They're stopping all of the emergency procedures they had. They stopped all the funding for it. People are going back to the office, crap like that. Even my place that I work at, which I actually have a really good job, and which will remain nameless. I'm not telling you people where I work. I really, really like my job. They've just had us go back to the office, right? And just right now, this we just recently started doing it like a hybrid thing. 3 days a week, we're going to be in the office, and just this week, there's another case of corona in our office. Like the same week that we all started coming back, somebody caught it, right? It's it's a joke. We are not capable of addressing as a species. We're just not capable of addressing these sort of crises like this. If we can't even get our shit together to stop an easily preventable disease from killing 7 million people, how are we going to stop global climate change? How are we going to do that? How are we going to cut our carbon emissions enough to where we don't cause irreparable damage to the environment and prevent a gigantic ecological collapse? We're not. We are not. We are not going to be able to do that. I got news for you. If you're a teenager now, if you are a parent with children now, the future for those kids does not look really good. If you're a teenager, if you're young in your 20s, 17, 18, 19, 20, 21, the future is going to suck ass for you. It's going to be horrible. And do your traveling now. Have your fun now, right? Enjoy life now, because in 30 years, it's going to fucking be a disaster. You think shit is expensive now. You think bread and milk and eggs is expensive now. You have no idea. I mean, what it's going to be in 40 years, in 50 years. You guys will be alive. If you're 18 right now, if you're 19, 20, 21, you'll be alive for this. I won't. I'm going to die within the next 40 years, probably, of old age. I will be dead 40 years from now. I will be dead of old age. Right. If I don't know, maybe if I'm lucky, I'll be alive. I'll be in my 80s at that point. But at that point, fuck it, who cares? Right? But I will most likely be gone and avoid the worst of it. You guys won't. You're gonna be living through this stuff. You're gonna be the people who are gonna be forced to eat cockroaches, right? I mean, that's a thing I'm seeing all over the place. That's a conservative meme I see now. I will not eat bugs. Yes, you will. You will eat bugs. You will eat them because that will be the only thing there is to eat. Right? Oh, yeah, there'll still be beef and chicken and fish, but it will cost so much that only the rich people are going to be able to afford them. Meat will be a luxury. Vegetables will be a luxury. I'm serious. You'll eat things like soybeans, and you will eat, reconstituted soybeans, crap like that. You'll eat earthworm burgers. You'll eat insect protein, and you'll do it because that's all there will be. You won't be able to afford anything else, right? Because that's what's coming. Bananas, extinct. Coffee, extinct. Any kind of flowering foodstuffs that requires insects to pollinate, extinct. Tomatoes, gone, right? Potatoes, all that stuff. Anything with flowers, gone, right? There may still be things like maybe potatoes or something like that. They might clone them or whatever. That's what's coming. That's what's coming, folks. And is anybody doing anything about it now? Because if you want to fix that stuff, you got to fix it now. We have to start passing laws now. We have to start getting funding for it right now, right? We need to, they're talking about stopping, like converting everything over to electric cars, right? By 2035. Do you really think that's going to happen? Do you really think by 2035 all of the cars in the United States are going to be electric? Fuck no. It's a joke. It's not happening. You know why? Because there's an entire segment of the population out there who modify their trucks and stuff to run off of coal. And they do it on purpose to piss off the libs. That attitude, that same attitude which led to the deaths of 7 million people during an easily preventable pandemic, is going to destroy the human race. It literally will. I give it, seriously, I'm 300 years if we're lucky. Shit, I'd highly fucking doubt it. I think really at this point the only like hope the human race has is like maybe creating a space station, a self-sustained space station or some shit. Like seriously, that's it. Because I don't believe that mankind as a species is just going to be able to get its shit together in time in order to stop what's happening, in order to stop the crises that are coming. And that's the lesson that we're getting from the way that we handled the pandemic, right? So, I don't know. I don't mean to be a doomer or whatever the hell you people call it now. People call these when you're, they call it, oh, it's doomerism. The world sucks, everything's shit, and it's all going to hell in a handbasket. It's not being a doomer. It's not doomerism. It's fucking reality. Right? So enjoy it now, Enjoy it now. I mean, I really don't think it's gonna do much, but does that mean you give up? No. Does that mean you don't do anything at all in order to try to make stuff better? No, of course not. You know, of course not. What you should do is fight until your dying breath, right? But I'm just saying, be realistic. Be realistic and with your expectations. And if you're a young person now, if you wanna have the same level of civilization, the same level of quality of life that we've been enjoying for 3 or 4 generations now, I got news for you, man. It's gonna be extremely tough. The rich people, of course, will have everything, you know. But I don't know. When I was a kid, I really thought the future was going to be like Star Trek. I really did. I really thought that we were going to be out there by the time I was my age that I am now. I really thought that we would be flying spaceships to the moon and Mars, and that we would have space tourism. You mean I didn't think yeah, okay, we wouldn't be like, fighting Klingons and shit on another planet or whatever. But I really thought we'd be further along in the evolution, the technologically advancement that we are now. I really thought that we would have things like a space station and a moon base and starting a colony on Mars. And I really thought that I would be able to take a flight up to the moon when I was an old person. And like, maybe there'd be people living there and that science would advance. And we're having some of this stuff, the computers, we got those. We're starting to get the robots. But the rest of the shit, no. It's being stagnant, right? I really thought we were going to have that, and we don't. We don't. We aren't. What's really happening, what's really coming is that the future is going to be more like Blade Runner, right? Very bleak environmental catastrophes, right? You guys saw Blade Runner? What was it? Blade Runner 2049, right? Excellent movie. You know, environmental disasters, orphans digging through garbage and stuff just to survive, right? Super rich people that have fucking everything, including robot slaves. That's where we're headed, folks. Right. While everybody else is eating worms, that's what's coming. That's what life in the mid 21st century is going to be. Who knows? Maybe if we can get over that hump, maybe one day it might get better, but not in our lifetime. Our lifetime is going to suck. And what can you do to protect yourself, protect your family from this? I don't know. Make a shitload of money. If that's what you're concerned about. Do things to help the planet. Recycle, plant trees. Vote for people who will actually enact a radical environmentalist agenda. I just think we should be realistic about our chances of survival. So one day, I don't know, maybe if mankind manages to get its crap together, we may survive. But I think at the very least, it's going to get way worse than it is before that happens. Hello folks, if you like what I do and you want to support the channel, please consider buying something from my Etsy shop, supporting me on Patreon, liking and subscribing, and checking me out across my social media links listed below. Thank you all so much, and see you next time.